Hi there, Dr. Sullivan here, Chronic Pain GP, and today's video is about relaxation therapies in the treatment and management of chronic pain conditions. I honestly feel that patients have lost the ability and skills to relax properly, partly due to being in pain constantly, but also the fact that we live such busy lives and information is at our fingertips that the skills which are needed to relax properly have been neglected. Some of you may feel that relaxation is a relatively easy activity to take part in. However, this is often very difficult for those patients who are in chronic pain. It's often the case that because chronic pain patients have lived with pain for so long, they've either forgotten how to relax or don't know how to relax. Now, I personally feel, and there is some research to back this up, is that because patients are in constant pain, there's often alterations in their hormonal changes. So, for example, hormones such as cortisol and adrenaline can become quite dysfunctional, and the body and mind can be in a constant state of agitation. Therefore, patients finding it very difficult to relax and wind down. Patients have been in chronic pain for vast amounts of time. The whole relaxation process is often very difficult to engage with. Essentially, relaxation calms the mind and helps recovery and recuperation of the body. It can help break the vicious cycle of increased pain, cause reduced activity, which then leads to increased pain, which subsequently leads to reduced activity, and so on. And this is a very common phenomenon I see in chronic pain patients. Now, one of the easiest and most effective methods of relaxation is to concentrate on breathing activities. I'm going to give some, two very quick examples of possible relaxation techniques, and they are as follows. Concentrating on deep breathing, which is getting into a comfortable position, whether lying or sitting comfortably. Taking adequate time to listen to one's own breathing, breathing in through the nose, concentrating on abdominal breathing, relaxing the stomach muscles, and taking slow, deep breaths at one's own pace. Often people, as they breathe out, can blow away the tension, and as they breathe in, can seem to be breathing in peace and tranquility. Another technique is often using progressive muscle relaxation, where you tense and relax each major muscle group, starting with the hands, moving to the arms, shoulders, toes, feet, legs, and facial muscles. The tenseness can be for durations such as 5 to 10 seconds, and then the relaxation phase can be much longer. There's lots of other methods out there, and another possible method is using imagery to relax. For example, again, getting into a more comfortable seated or lying down position, concentrating on one's deep breathing, breathing into the nose, holding for a few seconds, and then breathing out through the mouth. Often, the technique advises to think of a special place, whether real or imaginary. Imagine lying in that special place, and then using one's own imagination to look around you. What do you see? Imagining textures, smells, and sounds, and focusing on one special aspect of the special place. It's really useful to help wind down and ease back into the present, and all this time concentrating on your breathing to bring you into the here and now. Now, the duration and frequency of these relaxation techniques can vary from patient to patient, but suffice to say they can be done at home or in the workplace. Often they can be done for 5 minutes and sometimes longer. I advise strongly reading around the subject as it's a very useful technique to help with chronic pain management. There's also lots of technology out there to try and help patients relax, including audiobooks and apps. In conclusion, relaxation is a simple concept but often very hard to complete properly. Its fundamental aim is to reduce stress and anxiety, but also help relieve muscle tension. And it can also help release of the body's natural pain fighting hormones called endorphins. Research is ongoing with respect to the use of relaxation therapies long-term for chronic pain. However, due to the ease of its accessibility, its low risk of side effects, if any side effects at all, I would thoroughly recommend relaxation in the management of chronic pain. Next time, I will start to talk about the pharmacological based treatment for chronic pain, and I will start by discussing the pros and cons of the opioid based medications. I hope that video was useful. just enough time to say please subscribe to the channel, like and share far and wide. Leave any feedback down below, and thank you once again for taking the time out to watch this video.